General treatment. If the prostate is simply congested, the urine clear, the residuum negligible, there may be marked irritability of the bladder with frequent and painful urination. To conquer this, hexamethylenamine 0.5 to 1 gram TID, though it may irritate, and sedatives are efficacious. Instillations of 10% argyrol or 1% phenol are also useful. If there is retention without infection, the patient should be constantly on hexamethylenamine to prevent infection so long as any local treatment is being employed, and it is probably better that he should take a little of the drug at all times if there is more than 50 cc's of residuum. If there is infection, the treatment is that of prostatitis or of retention cystitis, as the case may be. Hexamethylenamine is again the backbone of the treatment. It may be given for short periods of time in doses as high as the patient can bear in the hope of controlling the infection. The treatment of renal infection is fully detailed elsewhere, page 361. The bowels and stomach often require special attention by cathartics, vegetable and saline, enemata, gastric lavage, etc. Opiates. A final word on the subject of opiates. Prostatism is a chronic disease and pursues a most uncertain course. The sufferer, writhing in agony today, may be entirely relieved tomorrow. The patient whose last sun seems to have risen may be relieved by operation and survive for many a year. Under these circumstances, it is scarcely necessary to insist that opiates should be administered with extreme caution. The patient, a constant sufferer from a tormenting disease, is in an ideal condition to become addicted to narcotics. I have seen few sadder cases than those of old men whose prostatic disease was still curable, while their subjection to narcotics could not be overcome.